Hello, so in this video we'll present you 4 essential neurological tests such as weel barrowing, extensor postural thrust, visual placing, and tactile placing. These tests help us evaluate proprioception, motor control, and sensory pathways. Postural reactions tests are made to assess an animal's awareness of its body and space. We'll start with a brief anatomical and physiological review. There are proprioceptive receptors in the muscles, tendons, and joints that detect limb position. This information travels through peripheral nerves to the spinal cord, then ascend through the spinal cord to the brainstem and cerebellar cortex, where conscious awareness and coordinated motor responses are generated. Any disruption along this pathway can alter the animal's response during these tests. For the visual placing test, the visual information is first captured by the retina and transmitted through the optic nerve to the optic chiasm and optic tracts. Then it reaches the visual cortex where the image is processed. The brain integrates this visual input with motor pathway to generate an appropriate placing response when the animal approaches a surface. Now here are the tests. So this is weel barrowing. Here is extensor postural thrust. And this is visual placing. This is tactile placing. So now that we see the test, we'll see what result is expected in an animal with a pathology. So in animals with neurological pathology, postural reaction may be slowed, absent, or uncoordinated. For example, during weel barrowing, an affected dog may drag the paws, tumble, or fail to advance normally. In the extensor postural thrust, the hind limb may not extend properly or thrust may be weak or asymmetric. In visual placing, the placing may be delayed or absent if vision or forebrain pathways are compromised. And tactile placing deficits suggest sensory pathway dysfunction, peripheral neuropathy, spinal cord lesions, or cortical damage. So postural defects can be lateralized, meaning that they appear predominantly on one side. When the lesion affects one cerebellar hemisphere, the signs are contralateral, whereas if it affects the brainstem or spinal cord in a lateralized way, the signs are ipsilateral. So now we'll see what results are expected in a healthy animal and also how to perform the test properly. So in weel barrowing, you have to lift the pelvic limbs from the ground and move the patient forward with and without extending the neck. By extending the neck and elevating the head, visual compensation is removed. Limbs should move symmetrically. In extensor postural thrust, the patient is lifted straight up, then lowered to the ground. As the pelvic limb touch the ground, the patient extends the hocks and takes few steps backward to find its balance. And in visual and tactile placing, so for the tactile placing, eyes are covered with the patient in your arms, and slowly you approach a table and let the dorsum of the paw touch the table. The patient should be able to place the paw over the table. And in the visual placing test, the animal should be able to place the paw on the table before touching it, guided only by vision. Finally, in case of a pathology, what clinical signs can we observe? So if the deficit is in all limbs, the lesion can be affecting the brain or the cervical-spinal cord. If we have a lateralized deficit, it indicates a focal lesion. A contralateral deficit if the lesion is in one cerebellar hemisphere, and ipsilateral deficit if the lesion is in the brainstem or the spinal cord. If we have a deficit in both pelvic limbs, it suggests a spinal cord lesion caudal to T2 that is within segment T3 to L3 or L4 to F3. It's evident during weel barrowing or extensor postural thrust when pelvic limb strength or coordination is reduced. And finally, we have the abnormal visual placing with normal tactile placing that indicates the involvement of a deficit in the visual pathways rather than proprioceptive or motor pathway. Observing and interpreting these reactions is essential in forming an accurate neurological diagnosis, and thank you for watching.